welcome to the office today. My name is Dr. Jones. Please make yourself nice and comfortable. If at any point you need anything during today's appointment, just let me know and I'll take care of you as best as I can. If you need a glass of water or if you just need a quick break, that's absolutely fine, of course. Please don't hesitate to speak up. So, you've been sent to me today for a cranial nerve exam, is that correct? Yeah. Okay, so have you ever had a cranial nerve exam before? You have? There we go then, that's excellent. I'll skip the explanation and we'll get right into it. But of course I will explain everything that I'm going to do as I'm doing it. Okay, so obviously during today's exam I'm going to need to come quite close and personal to you, and I may even need to touch areas of your face. Is that okay for me to do? Yeah, that's great. As I said, I'll explain everything I have to do as I do it, so there'll be no surprises for you. But basically, the tests that we're doing today will be very simple, very easy to follow. I'll give you instructions, you follow them, I'll take down the results, and it'll be as simple as that. It'll probably even be a nice relaxing experience for yourself. Okay, so we'll get started. I'll just pop on some latex gloves now just to keep things nice and hygienic, of course. Okay, so before we actually begin the cranial nerve exam itself, I just want to quickly ask you how you're feeling in general. Are you feeling any sort of general ill symptoms at the moment, like a sore throat or stuffy nose, headaches, anything like that? No? Okay, so before we begin, I do want to quickly listen to your heartbeat and your breathing, just to confirm that you don't have any minor illnesses that might affect today's results. Okay. Okay, so if you could lift your shirt for me, please. I'm just going to be placing this stethoscope directly against your chest, a few different locations. To begin with, we will just listen to your heartbeat. Okay, so I'll just place that there if that's okay. Very good. Sorry, I'm just counting your heartbeats at the moment. Okay. Okay, that seems very good. Seems like a strong, steady rhythm, which is exactly what we're looking for. Seems to be about within the average range as well, which is perfect. Okay, so I do just want to listen to your breathing as well, if that's okay with you. I'll just place it once again against your chest here, and this time if you could take in a deep breath for me, please. Very good. If you could breathe out for me now, please. Marvelous, that sounds great. I'm just going to move to a different location, and if we can repeat the same thing, please. Deep breath in. Very good, and deep breath out. Okay, there we go. Everything is sounding very good, very healthy from what I can tell. So for the first part of today's cranial nerve exam, I just want to do a very quick smell test with you. I have a few bottles here with artificial scent in them. What I'm going to do is I'm just going to hold them up to your nose. If you could take a quick sniff of them, and if you could tell me what you smell, please, that would be fantastic. Okay, so here we go. Scent number 1, if you could take a smell of that for me, please. Very good. And what do you smell there? Coconut, excellent. you smell from that one? Vanilla, very good. And now on to the third and final scent. Okay, let's present that for you. And again, if you could take a sniff, please. And what do you think that one smells like? Strawberries, very good. 3 out of 3. Perfect start to the exam. So now I just want to very quickly feel around your nose, if that's okay. So do you in general feel any stuffiness or trouble breathing at all? Any congestion of the sinuses? In general, everything seems to be okay, yeah? Okay, I can't feel anything that would indicate there's a problem there, and from what you said, everything seems to be very good. Okie dokie, so we're now going to move on to the taste test portion of the cranial nerve exam today. What I'm going to be doing is I'm going to be dipping little strips of paper into artificial flavour. Again, we will have 3 flavours as we had 3 scents before, and I'm going to be placing the strip of paper on your tongue, and if you could just identify the taste for me, please, that'd be excellent. Okay, so very similar procedure. I'm just going to have to quickly shake up each bottle, make sure the flavour is strong. Okay. I just want to dip this in there. Okay, and if you could pop your tongue out for me, please. That's excellent. I'm just going to place that on your tongue. Very good. And what flavour is that? Coffee. There you go. Very good. Good start. Move on to the second scent now. We'll just place a fresh taste strip into that one. And once again, if you could pop your tongue out. Very good, thank you. And what does that one taste like? Tastes like lemon. Fantastic, very good job, thank you. And now, on to the third and final taste test. Marvelous. Here we go, ready for the last one. There we go. And what do you think that one tastes like? Raspberry. There we go. Very good. 3 out of 3 on the taste test as well. Very good performance so far. Everything looking good. Okay, so now I'm going to start looking at your vision and your eyes, your optic nerves, how they are behaving. To begin with, I would just like to do a very quick and very basic eye test with a standard eye chart. So if you could please make sure that you're stood just about where you are now. Please don't lean forwards or anything like that. I'm going to hold the chart here. This distance from you is perfect. And first of all, I would just like you to do a general reading. Can you read this letter here for me, please? Very good. And this letter here. Good. This letter here. Good. This letter here. Good. This letter. This letter. This letter. This letter. This letter. This one. Very good. those. So now what I'd like you to do, please, is if you could cover one of your eyes for me. That's excellent. I'm going to point to random letters and ask you to read them out with just the one eye this time. Okay, so this letter here. Good, this one. 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 Good. Any letter on this line? Okay, there we go, very good. And now if you could switch to cover the other eye for me, please. Perfect. And now this letter, please. Good, this letter. 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 Okay, any letters here at all? Okay, no problem. You can uncover your eyes now. That's good enough performance. At least 20/20 vision, so very good there. And just very quickly, can you identify this colour here for me, please? Good. And this colour here for me, please. Very good. Thank you. Okay, so what I'd like you to do now is to focus your eyes on my nose, please. And I'm going to wiggle my fingers, perhaps one, perhaps the other, perhaps both, various locations within your field of vision. And I would just like you to tell me, please, left, right, or both, whichever finger I'm wiggling. Okay, so we'll begin that test now. Very good. 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 Excellent job. Now I'm just going to be marking the edges of your peripheral vision, so to speak. So what I'd like you to do is again to focus on my nose. I'm going to hold my fingers together and I'm going to move them in various directions like this. And when they leave your field of vision, I'd just like you to tell me. Okay, so I'll begin that test now. Here we go. Very good. 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 That's excellent. And for this next part, I'm going to flash up the number of fingers, and I just want you to quickly repeat back to me, or tell me rather, the number of fingers that I'm holding up. Okay, so here we go. Good. 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 Very good. 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 There we go. Excellent job. Very good. For the next part of the cranial nerve exam, I'm going to be needing to take you into the dark room over there. It's just literally a darker room than this one. I'm going to be shining a light into your eyes, observing how your eyes react, and we'll be doing a few tests involving light and darkness. Okay, so if you'd like to just take a step through to that room for me, please. Thank you. Okay, and welcome to the dark room. It's nothing special, I'm afraid. It is literally just a very dark room. So we're going to begin looking at your eyes now. I'm going to be using a torch. I'm going to be flashing this light into your eyes. You may find it a bit intense. If you need to blink, please do so, of course. But I am going to be trying to observe your eyes, so obviously please don't blink too excessively. But no worries. First of all, I just need to do a very general examination of your eyes. Okay, so just look straight ahead for this portion. That's absolutely fine. You don't need to do anything special at this moment in time. I am just observing how your eyes are responding and behaving in this light now. your eyes, but only moving your eyes, not moving your head. So keep your head nice and still, and then follow the light with just your eyes. Exactly, just like that. Very good. Okay. Marvelous. And how do you feel whilst doing this? You aren't experiencing any sort of eye strain, any discomfort or pain? No, nice and easy. There we go. Very good. That's what we like to hear. I'm just going to be increasing the speed a little bit. Any problems or unusual feelings with the increased speed? No, all okay. There we go then. Looking good. And now for this part, I want to place my hand along your nose, and this is to separate your eyes, so to speak. I'm just going to be flashing a light into the one eye, and I'm going to be observing how the pupils respond when only one eye is exposed to light stimulus. Okay, very good so far. I'm going to switch that over to the other eye. Okay. Okay, very good, very good. Okay, and now finally I'm going to be looking at your focus. Okay, so I'm going to hold my fingers here in the background, I'm going to hold the light quite close to you here, and I'm going to ask you to switch your focus from my fingers in the back to the light in the front. Okay, so if you could start focusing on my fingers, please. Good, and if you could switch focus to the light. Good, switch focus. Switch. 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 Okay, that's good. And now we're just going to be doing almost the opposite arrangement. Fingers will be very close to you, light afar in the background. So again, if you could start your focus on my fingers, please. If you could switch focus. Switch. 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 Okay, there we go. Very happy with the results of your eyes and how they're behaving with light stimulus. Okay, so if you'd like to step back into the other room now, we can carry on with the rest of the cranial nerve exam. Okay, do you need a quick break before we continue the cranial nerve exam today, or are you okay to continue? Okay to continue. Shouldn't be too much longer left, actually. But next, I would like to test your senses around your face and how you can feel things. Okay, so for this section, I'm going to be using this cotton bud, slightly different design to usual. We have a very soft, blunt end on this side, and then we have a sharper end on this side. I'm going to be touching you in various locations of your face, and I'd just like you to tell me sharp or soft, whichever you can feel. So obviously for this, I'm going to need you to close your eyes for me, please. Okay, and now I'll just begin touching your face. Sharp or soft? Yeah, very good. 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 eyes now. Each one identified perfectly. Thank you very much. Good job. Okay, so at this point now, I want to test some of your muscles, how they move, their strength, how they work, see if everything is okay, if there are any problems that might need to be addressed. Okay, so to begin with, I need you to make a few slightly silly facial expressions. If you could follow along with me, please. To begin with, I need you to puff your cheeks out for me, please. Very good. I need you to bare your teeth for me, please. Very good. I need you to frown for me, please. Very good. I need you to raise your eyebrows for me, please. Very good. So now I'm going to place my hand lightly against the side of your face, and what I want you to do is to move against my hand. I'm going to be applying a little bit of pressure and force to try and stop you. Okay, yeah. Use as much strength as you can, yeah. There you go, very good. And now the exact same thing, except in the opposite direction. Very good, very good. Placing both my hands on your cheeks now. If you could once again puff out your cheeks for me, please. Very good. Now I'm going to be placing my hand on the underside of your jaw, and if you could try and open your mouth, please. Very good, very good. Okay, now I'm going to be placing my hands on top of your shoulders, and if you could shrug up against them for me, please. Very good. If you could hold both your arms out now at arm's length, just like this, just like that. Perfect. I'm going to be holding either side of your hands on the outside here, and if you could push against my hands, just like that. There you go. Very good. And now I'm doing the same, but on the inside, if you could push inside. Very good. And if you could bring your arms up, push them up against my hands. Very good. And push downwards against my hands. There you go. Very good. All muscles looking as strong as they should be. Very good. Okay, so now I'm moving on to the hearing test portion of the cranial nerve exam. So to begin with, I just want to look inside both of your ears with an otoscope. This is just to allow me to see a bit more clearly if you have any buildup of wax, any inflammation, any signs of infection or anything out of the ordinary like that. Okay, so I'm just going to be coming in now and checking out this ear here. So it shouldn't be painful when I'm placing this into your ear. Do let me know if it is uncomfortable though, of course. Okay, can't see any bad signs there. And we'll move on to the other ear for you now, okay? Okay, everything looking very good. No excessive earwax buildup. No redness, no signs of infection. Good start. Okay, so now we're going to be doing a very basic rudimentary hearing test. For this, if you could close your eyes, please. I'm just going to wiggle my fingers next to one or both of your ears, and I would just like you to tell me, please, left, right, or both, depending on which ear you hear the sound in. Okay, so we'll begin doing that now. Yeah, that's good. Yeah, that's good. Very good. Okay, I'm going to do it a little bit more rapid fire now. Very good. Very good. 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 Very good. Very good. Okay, you can open your eyes now. For this next part, I'm going to be doing almost the same thing, but I would like you to tell me when you can no longer hear the sounds of my fingers wiggling. I'm going to be basically moving them further and further away from your ears. And yeah, if you can tell me when you can no longer hear it, please. Okay, here we go. Very good. Once more. Good stuff. And just the one ear now. Very good. The other ear. There we go. Looking good. And now I'm just going to be softly whispering a word or a number in either of your ears, and I would like you to repeat back to me the number or word that I say, please. Okay, so we'll begin that now. 21. Good. 34. Good. Banana. Good. Watermelon. Good. 7. Good. 6. Good, very good. Okay, that actually concludes today's cranial nerve exam. Thank you very much for following all the instructions perfectly. No trouble, I think, understanding each other. All okay. Do you have any questions for me about the procedure today? Okay. Yeah, well, what I'm going to be doing next is I'm going to be collating your results into a short report. I'll send that back to the doctor you saw previously. They will review it and they will contact you for a follow-up review appointment. They will do this even if it's just a general quick conversation with you, just to discuss the results, even if they're positive. So no need to worry when they do contact you. It's, could be positive, could be negative, but from what I've seen today, you've performed excellently well. I don't think there are any areas for concern whatsoever from what I can see, but obviously I need to go away, take a closer look at the results just to make absolutely certain, and then they'll be passed back onto your doctor and they will think of the next steps, a plan of action for you. Okay? Okay, yeah. Any more questions for me, sorry? All okay? Okay then. Thank you very much. You did excellently well today. Thank you. Take care. Have a good day. Good to see you, yeah. Take care. Bye. Bye. Hi there, my name's Dr. Jones. Welcome. Please take a seat to make yourself nice and comfortable. Before I begin today, can I just quickly confirm your name and your age? Okay. Excellent. And you are here today for a cranial nerve exam, is that correct? Yeah? Yeah, brilliant. So the examination itself is going to be very, very simple. I'm going to be conducting a series of tests on you. I'll be giving you instructions before I begin each test. It'll be nice and easy to follow, so no need to worry. It should be quite a nice, relaxing day for you actually. Shouldn't be too long either. The cranial nerves are just nerves that are spread across the neck and your face region. We're just going to be checking that everything is behaving and working as it should be today. So I will need to be coming quite close to you at a few points during today's examination, and I'll probably need to actually touch you on the face, perhaps your shoulders and arm region as well. Is that okay for me to do? Yeah, excellent. Okay, I think we'll jump right into it then. Can I ask you before we begin the first test, have you noticed any changes in your sense of smell? Not noticed anything. Okay, we'll just do a very quick test to confirm that. I basically have 3 bottles of different artificial scent. I'll shake them up a bit quickly, and then I'll ask you to smell the scents and identify them for me. Please just tell me what you smell if you can. Okay, so smell number 1. There we go. If you could smell that for me, please. And what do you smell? Orange. Very good, very good. On to the next scent. Here we go. If you could smell that for me, please. And what do you think that smells like? Vanilla. Very good, very good. And on to the 3rd and final scent now. Okie dokie. There we go, if you could smell that one too. And what do you think that one smells like? Coffee. Very good, very good. All 3 correct. So it does appear that your sense of smell is perfect. On to the next part of the test. First of all, have you noticed any changes to your sense of taste recently? No? Okay. So this is very much exactly the same as the scent test, really. I have 3 strips of paper with artificial flavour on each one. I'm just going to place them on your tongue for a moment, and then I would like you to identify the flavour for me. Just tell me what it tastes like, please, okay? Cool. Okay, so here we have taste strip number 1. If you could pop your tongue out for me, please. Yeah, I'll just pop that on there for you. Great, and what do you think that tastes like? Pineapple. Very good, very good. On to taste strip number 2. If you could pop your tongue out once more. Very good, thank you. Pop that on there. And what does that one taste like? Cheese. Very good, thank you. Sorry, I'm just going to have to make notes as I go along throughout the exam. I hope that's not too annoying for you. But on to taste strip number 3. Same thing, of course. Tongue out. Brilliant, thank you. And what does that one taste like? Tastes like mint. Very good. There we go. 3 out of 3 on the taste test as well. Looking very good so far. Okay, so for the next part of the examination, what I'd like to do is I'd like to shine a light into your eyes. You can look anywhere you want. Try not to blink too much, of course. I'm just going to be examining your pupil size, pupil alignment to begin with, so I'll do that now if I may. Okay. Okay, looking very good so far from my initial inspection. Good response. Both appear to be responding at roughly the same rate, and pupil size is looking very similar, if not exactly the same, between both eyes. Okay, so that looks good at the moment. So what I'd like to move on to now is a reading of this eye chart, please. So if you could just make sure that you're sat with your back against the back of the chair, please. Don't lean forwards, of course. I'm going to align this up here so we've got the correct distance now between yourself and the eye chart. And if you could just quickly read with both your eyes open to begin with. Top line. Very good. Second line. Very good. Third line. Very good. Fourth line. Very good. Fifth line. Very good. Sixth line. Yeah, looking good, looking good. Very good. Can you read these lines now? Getting quite small now. No problem if you have trouble. How about the final line? Can you read that one? Okay, having a bit of difficulty there. Okay, so can I ask you now to cover one eye, please? And I'm going to ask you to read random letters out to me, please. So, if you could read this letter for me, please. Very good. If you could read this letter for me, please. Very good. Can you read this letter for me, please? Excellent. This letter here for me. Very good. How about this letter here for me? Good stuff. This letter here. Marvelous. This letter here. Very good. And I'm just going to try and ask you to read this letter here for me, please. Okay, a bit of difficulty with that one. No problem, to be expected with the final lines. So could you now please cover your opposite eye for me, please? Exact same thing. Okay, so if you could read this letter for me, please. Very good. This letter for me, please. Good. This letter, please. Good. This letter, please. Good. This letter, please. Good. This letter, please. Very good. Again, can you read any of the letters on this line, actually? Any letters? Okay, okay. Yes, and finally, before I put the eye chart away, could you just quickly tell me this colour here, please? Very good. And this colour here, please. Very good, there you go. Thank you. Excellent, very good. Okay, I would just like to return to using the light in your eyes again, if I may, and this time I'm just going to pop my hand along your nose just to divide the eyes, so to speak. Okay. And now I'm just looking for how both pupils respond when I'm only applying light into one eye. Okay. Okay, looking good actually. Yeah, looking very good, thank you. Okie dokie, so now I'm going to be looking at the focus of your eyes. I'm going to hold up a pen quite close to you here. I'm going to hold up my light quite far in the background here. And I would like you please to focus on the pen. Very good. Now if you could change your focus to the light. Very good. Switch focus to the pen. Very good. Switch focus. Good. Switch focus. Good. Switch focus. Good. Switch focus. Okay, looking good. Now I want you to keep your vision focused on my nose, please. And I'm going to flash up a number of fingers in the corners of your vision. And I would like you to please tell me the number of fingers I'm holding up. Okay? Okay, here we go. Yep. 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 Good. 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 Very good. Excellent. Okay, so now I'm going to be using the light again, but this time I would like you to keep your head still, but keep your eyes focused on my finger as I move my finger around. So, exactly, just like that. Thank you very much. That's great. Okay, that is good. Just switching fingers if I may. Very good. Okay, superb, superb. Thank you very much. There we go, that's looking good. Next, I'm going to be checking the edges of your peripheral vision, so to speak. So for this, I want you to focus on my nose. I'm going to hold my fingers together, move them in various directions, and when they leave the edges of your peripheral vision, I want you to tell me, please, okay? So we'll begin that now. Focus on the nose. Very good. Very good. Very good. Very good. We've come a little bit closer now. So, here we go. Very good. Very good. Very good. Very good. And far away. Good. 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 That looks as I would expect it to look. So for this next part, I'm going to be checking if you can identify movement at the edges of your peripheral vision. So again, just remain in focus on the nose, please. I'm going to hold my fingers up like this. I'll be wiggling one or the other, or both. And if you could tell me left, right, or both, please. Okay, so here we go. Very good. 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 Very good. Very good. Very good. Everything looking good, thank you. So now I'm going to be testing your sensation on your face, how you have the ability to feel things. I'm going to be touching you with either end of this cotton bud. As you can see, one end is very soft, the other end is a little bit more pointed, and you'll be able to feel the difference. What I would like you to say is soft when I touch you with the nice soft end, and sharp when I touch you with the sharp end. It's not actually sharp, of course, but you get the gist. Okay, so if you could close your eyes, please. Very good. And I'm just going to now touch you at various places on your face. Okay, so here we go. Very good. 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 Very good. Very good. Very good. 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 so now I just want to feel the muscles around your face, if I may. I'm just going to be touching you in various areas around the face. Here we go. I'm going to be looking for involuntary twitching responses. I'm going to be looking for any sort of muscle weakness, anything abnormal, and of course, if you could tell me please if you feel any pain or discomfort at any point during this. Okay, so I'm going to hold my hands against your cheeks now, and could you puff your cheeks out for me, please? Yeah, very good. I'm going to be placing my hand under your chin, applying a little bit of pressure. Can you try to open your mouth for me, please? Okay, very good. I just want to test your reflexes on your face, so I'm just going to be tapping you various places. That's great. That's great. Very good. Very good. Okay, looking good then. Okay, so now it's a little bit of a silly part of the exam, so to speak. I'm going to need you to make a few exaggerated expressions for me, please. So first of all, if you could raise your eyebrows in surprise for me, please, kind of like this. Very good. Now if you could close your eyes as tightly as possible for me, please. Very good. Again, I would like you to puff your cheeks out for me, please, like this. Very good. And now I would like you to purse your lips out for me, please, like this. Very good. And if you could bare your teeth for me, please, and like a big grin, like. Very good. Okay, thank you very much for doing that. Okay, so now I'm going to be placing my hands on your shoulders, please. Can you shrug up against me, please? Very good. Obviously, I'm applying a bit of pressure just to try and resist your movement and feel your strength. So, could you hold your arms out straight for me, please? Very good. I'm just going to be placing my hands on top of your hands. Can you raise your hands up for me, please? Your arms. Very good. Same thing, but now downwards against my hands, please. Very good. Out to the sides for me, please. Very good. And inwards to the center for me, please. Very good. Okay, so I do believe I can move on to the ears now. I'm just going to be using an otoscope to look into your ear canal ever so slightly. So this shouldn't feel too bad, shouldn't be any major discomfort or anything, but of course do let me know if you do feel anything like that. I'm just generally looking at your ears and ear health at the moment, looking to see if there's anything like inflammation, excessive buildup of earwax, anything that may impact your hearing. Okay, so I'll move on to the next one now. There we go, brilliant. So not feeling any discomfort or pain whilst I'm doing this? Oh, very good, very good. Okay, everything actually looks very good. So now I'm just going to whisper a number or a word in your ears, please, and I would like you to repeat the number or the word back to me. Okay, thank you. So here we go. 72. Very good. 68. Very good. 101. Very good. very good. We'll do just the one ear now. Very good. Same, but in the other ear. Very good. I'll just read you once more. Marvelous. Very good. And then both ears as well. Okay. Brilliant. Excellent. Okay, so we're actually almost at the end of the examination now. I just want to quickly look into your mouth with a light. Okay, so if you could open your mouth for me, please. Very good. And can you stick your tongue out for me, please? That's great. Could you swallow for me, please? Looking good. And could you cough for me, please? Okay, that's quite good. I just want to quickly take a listen to your lungs, if that's okay. So I'm just going to use this stethoscope. There we go. And I'm going to need to pop this against your bare chest, if that's okay. So if you could move your shirt to the side, please. Very good. Just place that on there. Apologies if it's too cold. So breathe normally for a moment. Okay. Could you take a deep breath in for me, please? Okay, that sounds good. And breathe out as well. Okay, that sounds fine. I'm just going to do one more location on the lungs, if I may. And if you could take a deep breath in for me, please. Okay, very good. And deep breath out for me, please. Very good. Okay, I just wanted to double check how your lungs sounded, just based on the cough, but everything absolutely fine, nothing to worry about. Okay, so there we go. I have performed all the tests and examinations that I've needed to perform on you today. Collected all the information that I need to collect. I'm going to be forwarding this to your local GP so they have all the information they need the next time you have an appointment with them. I see no problems today. You've performed excellently in all areas of the examination. Obviously very positive, very good sign. So yeah, I don't believe there's anything that we require you to do. As I said, your local doctor will be in contact with you for any next course of action required. So I do believe that's the end of the exam. Any questions you might have for me today? No? Okay then, thank you very much. Thank you for coming. Thank you for performing so well during today's tests. Brilliant, yeah. Take care. Have a good day. Bye. Hi there. My name is Dr. Jones. Thank you so much for inviting me into your house today. I must say, absolutely lovely decoration you have going on in your house. A fantastic house. I'm very jealous, in fact. I wish my house looked as good as yours. Now, obviously, it's a bit unusual for me to do home visits, but for you, I don't mind making an exception. It's a little bit exciting for me as well to get out of the office and to be exposed to a new environment, I suppose you might say. Anyway, I think we should address the issue, the reason why you phoned me and asked me to make a home visit to see you today. So apparently you've bumped your head, is that correct? So what exactly happened? How did you bump your head? I see. Terrible accident, but it doesn't sound too bad. Obviously, doesn't look too bad. There's no excessive bleeding or anything like that. Very good sign, but obviously you did the right thing in getting a doctor to check you out, of course. Best to get them looked after, just to see, make sure you're okay. Okay, so before I do anything, I'm going to put on some gloves, some latex gloves, just to make sure that everything we do today is nice and hygienic, even though I'm in a different environment to my office. Obviously things are non-sterile. Not to suggest that your home is filthy. Not the case at all, I'm sure. But my office is a very sterile environment, a very controlled environment. But still, we will try and practice good hygiene today. On now. I'm all nice and ready to give you a little inspection. So before I actually jump into any examination of you, I'm going to actually just listen to your heart and to your lungs, just to get a very quick understanding of your health, to see if perhaps you have a cold or anything like that that may affect the results of the other examinations that I perform on you today. Okay. Okay, so I'm just going to place the stethoscope on your chest now, if I may. Yep, very good. And for now, I'm just going to listen to your heartbeat very, very quickly. Probably only need to do this for 20 seconds, just to get a general understanding of your heart rate and the strength and the general health of your heart. Okay, very good. Very good indeed. I like what I'm hearing. Sounds like you have a very healthy heart, very strong heart as well. Good heartbeat. Good heartbeat. Excellent job. Okay, now pretty much the same thing, except I'm going to be listening to your lungs. Okay, so once again, placing the stethoscope on your chest. This time though, if you could take a big breath in for me, please. Okay, so good, and out. Excellent. I'm gonna move the stethoscope to another location on your chest, and a deep breath in for me, please, once again. And breathe out. Very good, very good. The third and final breath, third and final location on your chest. Okay, deep breath in for me. And breathe out. Okay, marvelous. I am very happy indeed with what I'm hearing with your heart health and your lung health. So we're off to a very good start indeed. Okay, so unfortunately today I wasn't able to bring all my equipment with me to your house, but I do have enough to perform the cranial nerve exam that I'm doing on you today. Okay, to check your head, to check the little bump on your head, to make sure that no damage was done to you. Okay, let's start off using the deck of playing cards. Okay, so first of all, I just want you to identify the color of this card for me, please. Red or black? Black, very good. I'm just going to do that a couple of times with you. Okay, so the color of this card. so what number is this card? It's a number 5. Very good indeed. Very good indeed. Let's have a look. And what about this card here? What number is this card? Number 4. Very good indeed. Okay, just a couple more times now. No problem, no problem. Oh, it's a bit of a storm outside. I think I can hear some thunder and lightning. Okay, so what number is this card? Number 7. Very good indeed. Very good indeed. Okay, one last card for me, please. What is this number? It's number 8. Number 8. Very good indeed. Okay, that's enough with the playing cards. I just wanted to see how your eyesight is working there, if you can see colour correctly, and if you can read the small letters on the card. Okay, so off to a pretty good start, I must say. Now what I'd like you to do is I'd like you to keep your head nice and still for me, please, and I'm going to hold my finger up and I'm going to move my finger in various different directions, and what I want you to do is I want you to focus your eyes on my finger. Okay, I'm going to change to this finger. Focus your eyes on that finger for me, please, and now follow the finger as it moves using only your eyes. So do not move your head, keep your head nice and still, but follow the finger, okay, as it moves. Very good job indeed, very good job indeed. Let's switch fingers. Very good, keep going, keep following the finger. Excellent, excellent. Now, are you experiencing any pain or any eye strain whilst you try and follow this finger? Not feeling anything bad at all? Keep following, very good. Okay, so you feel okay right now? No headaches, no headaches. No eye strain, no pain just behind the eyes. No pain just behind the eyes. Okay, so feeling good so far. Excellent sign. Now I'm just going to observe your eyes. If you could look to your right, I believe it is. I hope that's the correct way, sorry. Sometimes I get my left and my right confused. But if you could look at my finger, which I think is to your right. Very good, very good. Just keep looking at it for a moment. Okay, now look at my finger over here, which I believe is your left. It's your left, I think. Look at the left finger. Just looking at your eyes, the whites of your eyes, the extremities of the eyes. Okay, very good. If you could look up at this finger, up here. Very good. Thankfully, I do not get confused between up and down, so at least I've got that much going for me. Very good. If you could look at the finger down here for me, please, at the bottom, downwards, please. Very good. Very good. I'm just looking at your eyes. I'm just looking at your eyes. Very good. Okay. I like what I'm seeing. Okay, so now what I'm going to do is I'm going to click a finger like that, and when I click it, I want you to focus your eyes on the click of the fingers, okay? And it's going to be changing different places. It's going to be random. So your eyes should be focusing over here now at these fingers here, okay? Very good. Let's keep going. It's going to be random. Which one is it going to be? Which one's going to click? Which one are you going to have to look at? Okay, very good. I'm looking at your reflexes, the speed at which you respond. Very good indeed. Let's keep going. And also, when you make a fast, certain movement with your eyes, when you focus your eyes in such a fast way, I want you to pay particular attention to see if you feel any eye strain or pain, any headaches, anything like that. That's what we're looking out for today, realistically speaking. Okay, so you've done pretty good there. One last one to trick you, but you did well. Okay, so now what I want you to do is I want you to focus both your eyes on my finger, and I'm going to be bringing my finger closer to you, very close indeed, in fact, and then further away from you. Okay, but continue to focus on my finger at all times. edges of your peripheral vision. Okay, so for this I want you to once again keep your head still, of course. Focus your eyesight on my nose. So some more thunder outside. Some more thunder, perhaps. Focus your eyes on my nose. And what I'm going to do is I'm going to move my fingers like this in lots of different directions. Okay? And when I do that, I want you to tell me when you can no longer see my fingers, okay? So when they leave your field of vision, you're going to tell me, okay? So let's do that now. Focusing on my nose. Here we go. Tell me when the fingers leave your field of vision. Good. I'm going to be doing this for different directions. Good. Different distances from you as well. Good. Just checking to see if your peripheral vision has been affected at all from the bump on your head. Okay. So. Good. And now I just want to come up really close to your eyes, really close, and let's have a little measure of the peripheral vision, really close to your eyes. Okay. Oh, marvelous. Oh, very good. Okay, looking nice. Looks like you have a nice large field of vision, which is exactly what we want. Very good. Now we're going to be performing the finger wiggle test. Okay, so keeping your eyes focused on my nose once again throughout the entire duration of this little test we're going to do now. And now what I'm going to do is I'm going to wiggle one of my fingers or the other, or both, and I'd like you to tell me, please, left, right, or both, which fingers that I wiggle. Okay, here we go. Good. Very good. Okay, marvelous. Of course, we're just checking to see if you could detect motion in various different ranges within your peripheral vision here. Okay, very well performed there. And now I'm going to flash up a number of fingers in your peripheral vision, the edges of your vision, like here and like here, various different places, and I want you to tell me the number of fingers that I hold up. Okay, again focusing on my nose throughout this one. Okay, so here we go. Very good. Marvelous. Very good. Oh, very good. Good. Okay. Excellently well done. Well done. Okay, so I am satisfied that your eyesight has not been affected by the bump that you took on the head. So you're doing very well so far. Very well so far indeed. And now I'm going to be checking your sense of smell and your sense of taste. Okay, and for this I actually have a few small bottles of artificial flavors. We'll do the flavors first. We'll do the taste test first. Okay. What's this one? Okay, very good. What I'm going to do now is, if you could stick your tongue out for me, please. Stick the tongue out for me. Okay, now I'm just going to pop a little bit of this artificial flavor on your tongue. Okay, very good. Put that down there. What do you think that tastes like? Mango. Very good. You got it correct. Now, we are going to be doing this with 2 more flavors, just to make sure that you are able to taste everything normally. Okay, so here we go. Number 2, Okay, here we go. Let's have a quick look. Which flavor is this one? Okay, good. Okay, you're ready to taste this one. Ready to taste it. On it goes. On the tongue it goes. And what does that one taste like? Strawberry. There we go. 3 out of 3. Your sense of taste is working perfectly. So we shall go on to the olfactory sense now. The sense of smell. That's a fancy word for the sense of smell. You probably know that. You look quite intelligent. You look quite intelligent. Okay, for this one, just shaking up my little artificial smells for you. Okay, let's have a look. What is this one? What is this one? Okay, I've got it. Okay. If you could take a smell of that for me, please. Take a little sniff. Okay. What do you think that one smells like? Coconut. Very good, coconut. I love coconut. Coconut. It's got to be one of the best smells, don't you think? Coconut shampoo is probably all-time best shampoo. All-time best shampoo. I love it. When women smell like coconuts, I don't know, it just does something for me. It just does something for me. Neuron activation. Neuron activation. Okay. Smell number 2. Smell number 2. Okay, let's have a little sniff of that one, please. What's that smell like? What does that one smell like? It smells like lavender. A very good lavender. Excellent. Lovely smell, lavender. Lovely smell. My mum used to grow lavender plants in the garden, so that's got a bit of nostalgia for me. And plant. Marvellous plant. Okay, here we go. The final smell for you to identify. I think you'll have no problem with this one. Should be nice and easy. Okay, so sniff, sniff, sniff. What does that one smell like? Mint. Marvellous. Marvellous job. 3 smells out of 3 smells correctly identified. 100% success rate. Once again. Doing very well. Doing very well indeed. Okay. The next thing that I want to do is I want to test your face to see if it can feel this brush when I brush against your face in various different locations. Okay. So for this one, of course, I need you to close your eyes for me, please. Close your eyes. And I'm going to be brushing you, touching you on the face randomly with the brush. And I want you to tell me, please, when you can feel the brush on your face, okay? Did you feel it then? Did you feel the brush then? Very good. How about then? Did you feel the brush then? Okay, good, good. Did you feel the brush then? Very good indeed, very good indeed. Did you feel the brush then? Good. That was a trick. I didn't touch you with the brush then, but I asked you if you felt the brush against your face, and you correctly answered that you didn't. Very good. I was just testing you then. Did you feel the brush then? Feel the brush. Very good. Very good. Did you feel the brush then? Very good. Did you feel the brush then? Very good. Did you feel the brush then that time? Very good. Okay, you can open your eyes now. I'm very pleased. Very pleased. Very pleased with that indeed. Okay, now I'm going to need you to make a series of facial expressions for me. First, I want you to puff your cheeks out as big as you can. So, very good. And now I want you to frown for me, please. Big, big, angry frown. Very good. And now I want you to do a sad face. Sad face. Very good indeed. And now a big grin. A big grin. A big grin. That's okay, you don't need to be embarrassed about your yellow teeth. My teeth are also yellow. Too many energy drinks for me. Well, what about you? Coffee? Coffee, is it? Well, we can't avoid it. We can't avoid it, can we? Okay, very good. Very good with the facial expressions. I'm going to place my hand against your head. I want you to push your head against my hand. I'm going to be applying some force though, trying to prevent you. Very good, okay. And now we're going to be pushing against this side for me, okay? Very good. Now I want you to push up against my hand. Okay, very good. Now hand on your chin, push downwards for me please, like that. Very good. Okay. Can you hold your arms out straight for me please? Very good. I'm going to be popping my hands just on top of yours, and I want you to try and push upwards with your arms. Lift your arms up, okay? Okay, very good, very good. I'm going to be placing my hands underneath yours. I want you to push downwards against my hands, okay? Downwards against my hands. Okay, very good. And now I want you to push outwards against my hands, okay? Outwards, very good. And now inwards against my hands, okay? Try and squeeze them together. Very good. Okay, and the final thing that I need to test is your hearing. Okay, so I'm going to whisper some words, some numbers into your ears, and I want you to repeat them back to me, please. Okay, so here we go. Coconut. Very good, coconut. Very good. Technical. Technical. Very good. Very good. Banana. A banana. Very good. Very good indeed. A cucumber. Cucumber. Very good indeed. Very good indeed. 67. 67. Marvelous. 231. 231. Okay, so that was very well done indeed. What I'm going to do now is I'm just going to click my pen left or right of your head. I want you to close your eyes for this one, please, and I want you to tell me which side you hear the pen click on, okay? Hopefully you can hear the pen click over the sound of the loud motorists outside your house. Very loud road outside your house, isn't there? That's not very good, is it? Otherwise a beautiful house though. Beautiful house otherwise. Okay, but if you could close your eyes for me now, please. Close your eyes for me now. Which side can you hear the pen click on? Very good. Okay, let's do that again. Excellent. Very good. 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 Very good. Okay, you can open your eyes now. I'm just going to make a few notes. So I'm very happy with the results of today's cranial nerve exam. I think you've performed very well for each and every one of the tests. I think we've got some good results here, some very good results, and I do not think there's anything to be concerned about at all regarding your health and regarding that bump on your head. I think it must have been a very light bump on the head. Maybe you didn't feel like it at the time, of course, but thankfully no damage has been done. Okay, so there's no need for any further testing or anything of that nature. All I would recommend is just take it easy for the next day or two, you know. Maybe stay indoors, maybe rest, put your feet up, read a nice book, watch a new series, something like that, you know. Indulge yourself. I can write you a doctor's note if you want for work, so you can have a nice couple of days off. Would that be okay? Yeah? You want that? Yeah? Very good. Very good. Any excuse for a couple of days off work, you may as well take it. You may as well take it, I think. Okay, do you have any questions for me before I leave you today? majority of that time pass by, thankfully. I think we are all active aboard the ship for about 3 years in total. It's not going to be in one block, but rather a few separate segments of time, and I believe this is to help us navigate the more dangerous regions of space. But there's no need to be concerned. The spaceship is well staffed with a wide variety of experts, and I'm sure that we will safely arrive at our destination, the new planet that we are hoping to colonize. So that should be very exciting when we arrive. A few notes for you whilst you're living aboard the spaceship. I would like you to take particular care and attention to these points in terms of your health, okay? So what I would like you to do, the first thing I would like you to remember is to go to the gym about 3 times per week. 2 to 3 times per week should be fine. And I would like you to focus on resistance-based training, so strength training essentially. This is particularly important whilst we're aboard the spaceship, because there are going to be times when we're exposed to lower gravity, so less than typical Earth gravity, and during those periods of time we may experience muscle atrophy, a loss in muscle mass, and we may experience a loss in bone density as well. That one is particularly concerning. So in order to combat this, I do encourage every single person on the spaceship to go to the gym, the onboard gym, 2 to 3 times per week, and to focus on strength-based training. You don't have to do anything crazy, you don't have to become a bodybuilder, but just a little bit to maintain muscle mass at the very least, and bone density, very important. And the second major point that I like to tell everybody is, please do make sure that you take all the supplements that are provided to you whilst you're aboard the spaceship. And this is of course because the food that we will be eating aboard the spaceship, it's not perfect, it's not the most nutritionally dense food possible. In fact, a lot of it is dry freezed food, long life food. It's not ideal in the least in terms of nutrition and health, but if you take all the supplements that you are given every single day, you'll be absolutely fine. So those are the only 2 points that I really encourage everybody to remember and to focus on for their health whilst they're on board the spaceship, is just go to the gym 2 to 3 times a week and take all your supplements. Okay, so what are we going to do today? Well, I have a large number of tests that I need to run on you and all other personnel aboard the ship, just to get a general understanding of everybody's health and to maintain their health whilst they're here. I'm obviously not going to do all these tests in just one session. In fact, I'll keep things pretty short. I think each session should last about 30 minutes maximum, I think. I believe today we shall do the cranial nerve exam. It's a favourite among the patients for some reason. I think it may just be the relaxing nature of it. Okay, so it's going to be very, very simple indeed. Everything that we need to do today I will explain as we go along, so there will be no surprises for you. And yeah, no need to be nervous or anything like that. Okay, so before we actually begin, is there anything you need? A glass of water, a quick break? No, all okay? Okay, so we'll start off, and the very first thing I need to do is just to ask you, I believe, 4 questions. So these 4 questions are just to help me to get a very general understanding of your health to begin with. Okay, so first question, what are your medical and surgical histories? for that. Our next question, what prescription and non-prescription medication do you take? Okay, thank you. Next question. What allergies do you have? Any allergies at all, even food ones I'm interested in? Okay, and our final question, what is your smoking, alcohol and drug use history? Okay, thank you so much for answering those questions for me. That is all finished now. So we're actually going to start the cranial nerve exam itself now. I'm going to pop on a pair of gloves just to keep things nice and hygienic, of course. Examination, I'm going to have to come quite close and personal, and I will have to touch you in a couple of places, mostly the face, shoulders, probably the arms and the hands as well. Is that okay for me to do so? Yeah, excellent. Okay, very first thing is I just want to have a quick listen to your heartbeat and to your lungs using the stethoscope. Okay, just a very basic test that I need to do before we start the real cranial nerve exam tests. Okay, so there we go, just warming it up a bit, making sure it's actually working as well. Okay, so I'm just going to place this on your chest, and I'm just listening to your heartbeat to begin with. Okay, so there's no need for you to do anything in particular. Okay, sounding very good. Good steady rhythm, good rate, good strength as well. Very good. And now I'm just going to place this on another location on your chest, and for this one, if you could take a deep breath in for me, please, and out. spasms or twitching. And also I would like you to tell me, please, if you experience any pain or discomfort at all during this section, okay? Okay, so feeling okay so far, yeah? Very good, very good. Let me just check here. Looking good so far, looking good so far. Just looking at how the skin responds as well from some light palpation. Okay. Come in here on the sides as well, see about that. Okay. What I want to do now is a very quick and simple test. I'm going to ask you to close your eyes in just a moment, and I'm going to poke your face with either this end of the pen or this end of the pen. Okay, and as you can obviously tell, one is a little bit pointed, one is very blunt. Okay, so one should feel sharp, so to speak, and the other soft, so to speak. Okay, so I want you to close your eyes now for me. Thank you very much. I'm just going to touch you on a random location on your face. There we go. Was that sharp or soft? Sharp, very good. Coming in for a second time. Different location. Sharp or soft? Very good. Okay, I'm going to speed it up a little bit now. If you could just tell me. Good. 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 Very good, there we go. You can open your eyes now. Okie dokie, so now I would like you to make a series of facial expressions for me, okay? A little bit silly, this portion of the test. You could think of it as, to begin with, I would like you please to puff your cheeks out for me, please, just like this. There we go, very good. And if you could frown your face for me, please. Very good. If you could grin as wide as you can for me, please. Very good. And finally, if you could raise your eyebrows as far as you can, please. Very good. Okay, so what I'm going to do now is I'm going to place my hands on either side of your cheeks, and I once again would like you to puff out your cheeks, please. Very good. As you can tell, I'm slightly applying some pressure now, so I'm going to pop my one hand on the side of your face. Could you please tilt your head to the side, push against my hand, just like that? Yeah, excellent. Same thing now to the other side, please. Okay, very good. Again, I'm just applying some gentle pressure, trying to gauge your strength. Okay, so if you could tilt your head backwards like that, very good. And if you could tilt your head now downwards, please, against my hand, very good. Okay, so for this next part, I'm going to be popping both my hands on your shoulders, and I'd like you to shrug your shoulders upwards for me, please. Yeah, very good, just like that. Okay, if you can hold your arms out straight for me, please, both of them. Very good. I'm going to place my hands on top of your hands. I'm going to be pushing down. I want you to raise your hands upwards, please. There we go. Very good. Now, placing my hands underneath yours, and if you could push downwards, please. Very good. Pushing my hands on either side of yours. If you could push outwards for me. Excellent. And the same thing, but now if you could push inwards for me, please. Very good indeed. Okay, we have come to the slightly fun section of today's cranial nerve exam. I have for you 3 artificial flavors, and I'm going to be giving them to you blind, so to speak. You won't know what flavors they are, and I want you to identify the flavors for me. Very good, very good. Okay, going to move on now to taste number 2, 3 in total. Okay, let's have a look how you will do with taste number 2. Okay, same thing. If you could pop your tongue out for me, please. Very good. Just a little droplet on there. And what a flavour is that one? Artichoke. Very good. That is a difficult one. Well done, well done. Okie dokie. And we are now moving on to the third and final flavour. Okay. Okie dokie. Here we go. If you could pop your tongue out for me, please. Very good. Just pop a little droplet on there once again. And if you can tell me what that one tastes like, please. Raspberry. Excellent job. 3 out of 3 flavours correctly identified. Very good. And now we have a very similar test. Instead of taste, we are looking at smell. Okay, so I have now 3 artificial scents. Okay, and I'm going to let you have a little bit of a sniff on each one. And if you can identify for me, please, what you think the smell is. Okay, so prepare your nostrils. Have a sniff of that for me, please. Very good. And what do you think that one is? That's lemon. Very good. Correctly identified. Marvellous. Okay, and now we move on to scent number 2. As with the previous test, the second one is actually the hardest to identify. Okay, so this may prove a little bit challenging for you. So if you could prep those nostrils once again for me, have a sniff of that for me, please. A sniff. Very good. What do you think that one smells like? Difficult one to identify. Would you like a second smell? Okay. Very quickly, I will allow a second smell. Take a sniff of that. What do you think that smells like? What do you think that smells like? Formaldehyde. That's correct. Very well done. That's a difficult one to identify, actually. And now we have our third and final scent. Actually, I believe this one is very easy to identify. In fact, if you would like to smell that one for me, please. What do you think that one smells like? Coffee. Exactly. There we go. 3 out of 3 smells correctly identified. Excellent job. Okie dokie. Let us take a look at those ears now. I think I'm just going to be using an otoscope to look into each of your ears. Obviously, I'm going to be placing this inside the ear canal ever so slightly, not very deep at all. Shouldn't be uncomfortable or anything like that. Okay, so I'm just going to do that now. Take a look at this ear here. Okay. Okay, a little bit of a wax build up in that ear. Nothing too excessive. I will check the same now in this ear as well. Okay, it's good. Pop that in there. Excellent. There it is. Excellent. Okay. Okay, looking very similar to the other ear. A little bit of wax buildup, but nothing too excessive. Okay, what I want to do is a rudimentary hearing test, so to speak. What I'm going to do is I'm going good indeed. Now I want you to once again identify which direction the sound is coming from, left or right. I'm going to be using something different to my fingers this time, so the sound will be a little bit different, and we'll do it a little quicker than last time as well. Okay, so which side is this sound coming from? Very good. Very good. Excellent. Good. 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 Very good. 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 Okay, now I'm going to whisper a few numbers in each of your ears, and I want you to repeat back to me, please, the number that I whisper into your ear. Okay, so we'll start doing that right now. 6. Very good, very good. Next number. 33. Very good. Next number. 162. Very good. Next number. 7,989. Very good. And now same test, but I'm going to be whispering words, okay? Hippopotamus. Very good. Rhinoceros. Very good. Technical. Very good. Coconut. Very good indeed. Okay, now I want to start looking at your eyes, and to begin with we're going to use this handy little eye chart that I have here. Please excuse the fact that there is a hole in the eye chart right here. Unfortunate indeed. I need to buy a new one. Okay, we will start off right away. If you could stay exactly where you are, please, and if you could read opposite eye for me, please. Same test, very quickly. Good. 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 Okay. Okay. Any letters on the final row? Okie, and this colour looking just as red as always. Very good. Okay, you can uncover your eyes now. Well performed, well performed. Okie dokie, now we are going to be performing something known as the finger wiggle test. Okay, very advanced test in the cranial nerve exam set. Basically, I want you to focus your eyes on my nose, please. And what I'm going to do is I'm going to wiggle one of my fingers, okay? Might be left, right, might be both. If you could tell me, please, which finger, left, right, or both, wiggles. Okay, so here we go. Good. Good. Good, just moving them slightly. Good. 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 Moving them a little. Good. 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 Excellent. Very good. Moving them. What's a little bit? How's that? Just observing your eyes as you do this. Very good. Okay, excellent job. What I'm going to do now is I want to mark the edges of your peripheral vision, so to speak, okay? So for this, once again, I need you to just continue to look at my nose. What I'm going to do is I'm going to move my fingers in various directions, and I want you to tell me when you can no longer see my fingers, okay? Very good, here we go, we'll do that now. Excellent. Good. Good. Good, okay. Going to be doing this quite close to your face now. Good. 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 I'm going to be taking a step away from you and doing the same thing, okay? So. Good. 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 Very good. Okay, and now I'm going to flash up a number of fingers in your peripheral vision. Still, I want you to only look at my nose, please, and I want you to tell me how many fingers I hold up, okay? concerned that I may have given you some irreparable brain damage, but I'm not exactly certain. So what I'm going to do today is I'm going to perform a cranial nerve exam on you, just to help me to get a general understanding of the damage that I have inflicted upon you. Okay, let's just see how much brain damage I in fact gave you. Okay, so before I actually begin, I'm going to pop on my latex gloves, mostly just because I don't like touching you. I'm not really that concerned about your hygiene and your safety. As long as you're kept alive, that's good enough for me. Just a moment. Just want to make sure I'm comfortable in my gloves. Okay, I'm feeling good, feeling nice and comfortable now. It doesn't really matter if you're comfortable or not. In fact, you may not even be able to feel anything if you have suffered extreme brain damage, which I think may be the case. Judging by that look on your face, you look a bit brain dead, if I'm being honest. But enough chit chat. Let's begin the cranial nerve exam, shall we? I believe the first thing that I need to do is to see if you can actually feel anything on your face. Okay, so just tell me, can you feel this? How was that? Could you feel that? You could feel that. Very good. What about that? Could you feel that? Very good. Feel that? Good. Can you close your eyes for me now, please? I want to see if you can feel it without seeing it, okay? I want to make sure that you aren't cheating. Okay, so here we go. How was that? Good, yeah. Very good. 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 Marvelous. Okay, you can open your eyes now. I think what I want to try is I want to try a different tool, a sharper tool. I think this fork shall suffice. It shall work perfectly for what I want to do, okay? So what I'm going to do, actually I will ask you to close your eyes once more for me, and I'm going to tap you either with the fork or with my finger. And what I would like you to do, please, is to tell me fork or finger. Okay, let's try that now. Okay, what was that? Fork or finger? Very good. And what was that? Fork or finger? Very good. Fork or finger? Excellent. I'm going to go a little bit faster now. Very good. Very good. Very good. Very good. Very good. Very good. Okay, it looks like you can distinguish the difference between being poked in the face with a fork and with a finger. So this is obviously very promising indeed. Now there is another test that I would like to do involving your cranial nerves, your facial feeling, shall we say, and that involves me doing a little something like this. Can you feel me slapping you on the face? How did that feel? That felt okay. Very good. That's very interesting, actually. I'm just wondering, though. I'm just curious. What about? How was that? How was that? Could you feel all the slapping of the face that I just did there? You could feel the slapping on the face. Okay, that's excellent. Excellent. On to the next test. Now, for the next part of our cranial nerve exam today, I'm going to need you to taste 3 different flavored liquids. Okay, now these are artificial liquids, it's okay. I'm going to drop a little bit on your tongue, and then I would like you to tell me, please, what it tastes like. Okay, so we're doing flavors first. Okay. Okay, if you could pop out your tongue for me, please. Very good. I'll just pop a little droplet on there. Just put a little droplet on there. Now, what does that taste like? Cyanide. Very good. You got that on your first go. Impressive. Impressive. Okay. On to flavour number 2. I'm curious if you'll get this one on your first try. Okay, here we go. Okay, tongue out for me, please. Very good, very good. Here we go. Little droplet on there, little droplet. And what does that one taste like? It tastes like asbestos. Very good. Your taste buds are working very well indeed, but just to be certain, flavour number 3. Here we go. Are you ready? Ready for flavour number 3? Okay, and what is flavour number 3? Can you identify that for me, please? Cucumber. Cucumber. Perfect. You got all 3 flavours perfectly correct on your first try as well. So we're looking very promising so far indeed. Maybe the brain damage that I thought I'd done to you isn't nearly as bad as I suspected. So 2 thumbs up so far. But we do have a lot of testing to go. Okay, so don't feel reassured just yet. Okay, of course, after the taste test, we do the smell test. Not sure if you ever had any cranial nerve exams before. I used to do them all the time when I was a real doctor. Now, of course, I've become an evil doctor because, frankly, being a good doctor, it just didn't fulfill me. Didn't fulfill me helping people every single day. Didn't fill me with any feeling of goodness at all, and the pay wasn't worth all the effort. You will not believe how annoying it gets treating people for the same illnesses day after day after day, and 90% of these illnesses these people cause themselves with their own stupid lifestyle choices. Surprise, surprise, if you drink 2 litres of Coca-Cola every day, you get diabetes. Surprise, surprise. But then they come running to the doctor for help. For help. I'm supposed to help them. Maybe stop being so stupid, and then you won't need to come to me. You know what I'm saying? Being a good doctor sucks. Being an evil doctor, that's excellent. Much more lucrative. Much more lucrative in terms of money. And what is more important in this life than money? Nothing, let me tell you that. Plus, I also get to torture people and cut them open and do all manner of horrifying experiments on them. And I mean, that just really gets me going, you know. Anyway, I've gone on a bit of a tangent there, my apologies. Here we go. I have for you a delightful smell. Please take a good sniff of that for me. And could you tell me, what does that smell like? Swamp. Very good. That is indeed the smell of a swamp. Okay. Going on to my second smell now. Ah, yes, of course. This is one of my favourite smells, actually. Okay. Prepare your nostrils, because here it comes. My favourite smell. Have a good smell. A good smell. A good sniff. A good sniff of that. All good. And what is that smell? That is indeed the smell of chlorine gas. Excellent job. Okay, and now we are on to our third and final smell. This one is my least favourite smell possibly of all time. I despise this smell. Absolutely disgusting. Disgusting smell. Okay, so prepare that nostril, or both nostrils. Yes, yes, very good. Take a sniff. Take a sniff. And what does smell number 3 smell like? Mint. Exactly. Disgusting smell. I cannot stand the smell of mint. Okay, I think what I'll do next is I'm going to use a stethoscope to listen to your heart and to your lungs. I probably should have done this before starting the cranial nerve exam, actually. I just want to make sure that I haven't really damaged you in any other way during some of the experiments that I've been doing on you. Okay, so I'm just going to place this on your chest and I'm going to listen to your heart for a little bit, okay? I can't imagine you particularly remember any of the experiments that I've done on you so far. I haven't done anything too invasive or terrible just yet, and every time that I do an experiment on you so far, I have made you unconscious. I've given you a little bit of a sleep potion to help you fall asleep, because there's no need to put you through any unnecessary suffering as long as I can do my experiments on you and obtain the results that I want. That's me happy. That's really me happy. Okay. Okay, heart actually sounding very robust, very strong and healthy. Marvellous, marvellous. I want to listen to your lungs now, so I'm going to be placing this on your chest once again, but now I would like you to take in a deep breath for me, please, okay? And breathe out. Very good, breathe in. And breathe out. One more breath, come on, you can do it. Absolutely marvellously healthy lungs there. I can't believe how good your heart and your lung health is. Very promising, very promising. Okay, let's use this next bit of time to take a look inside those ears of yours, shall we? I have here an otoscope, of course. I'm going to be placing this in your ear hole, okay? And I'm just going to take a quick look in there. Oh my goodness me. Oh my goodness me. Your ears are absolutely disgusting. Absolutely disgusting. That's foul. That's foul. I can't remember the last time I've seen something that bad before. Okay, I'm going to look in the other ear. I hope it's not as disgusting as the other one. But it is. It is, in fact, just as foul and disgusting as the other ear, possibly even more so. Possibly even more so. I didn't think that was possible. I thought some of the things that I created in this laboratory were horrific beyond imagination, but the state of your ears, that actually might be more horrific. More horrific. Okay, so I'm just gonna very quickly scrape some of that disgusting stuff out of your ears. Okay, so I'm coming in for a little bit of a scrape around in your ears now, using the cotton pad, of course. Using the cotton pad. How does that feel? Does it feel painful? is that feeling? Is that already feeling a lot better? Yes, I imagine it must be. Those ears were filled with some scary stuff indeed. Okay, so actually now the next part of the cranial nerve exam is to test your hearing. So perfect timing. I'm going to whisper some words directly into your ears, and I want you to repeat back to me, please, the words that I whisper into your ears. Okay, so here we go. Coconut. Very good. Superfluous. Very good. Nipple. Very good. Cranium. Very good. Diabolical. Very good. Domination. Very good. Now I'm going to do something very simple indeed. I'm going to click my fingers. Might sound a little bit unusual because I'm wearing these latex gloves, of course. But basically I just want you to tell me whether it's coming from the left or the right of your head. Okay, so here we go. Close your eyes as well, actually. Close your eyes for this one. Don't want you cheating. Okay, here we go. Very good. 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 Very good. Both sides. That was a trick, and you passed it excellently. Well done there indeed. Okay. I think I'm bored of inspecting your ears. I think it's clear that you can hear stuff, and that I've cleaned out some of that gunk as well. So ears are fine. Ears are fine. What I want to do now is I want to inspect those eyeballs of yours, and in order to do that, in order to get a good look at those eyeballs, I want to use this magnifying glass. Okay. Oh yes, absolutely spectacular eyeballs. Marvelous. Just incredible eyeballs indeed. Absolutely incredible. They look so spherical. Can you rotate your eyes for me, please, so that I can see just how spherical they are? Wait a minute, these aren't oblong-shaped eyes, are they? These aren't those rugby ball-shaped eyes. You don't have that thingy. I've forgotten what it's called. Stigmatism, is that it? Astigmatism. When you have a funny shaped eyeball. I only want perfectly spherical eyeballs in my laboratory. Okay, so if you've got rugby shaped eyeballs, you're going to be leaving the laboratory. And I don't mean walking out of here freely, of course, because you know too much at this point. What I actually mean is you will be leaving the laboratory, if you understand what I'm saying. You understand what I'm saying? Maybe not. Maybe that's a little bit too detailed, in depth for your brain to figure out. Okay, guess what I've got? A smelly chart. Yes, indeed. What do you mean? This is a Snellen chart. It's called a smelly chart, not a Snellen chart. Who is the doctor here? Who is the doctor here, me or you? I'm sorry, are you the doctor? No, you're not, are you? I'm the doctor, okay? So I think I know the name of this chart, and it's called the smelly chart, okay? So, shut up and read the letters for me, okay? quite satisfied that you can read the eye chart with both your eyes. Okay, so you can uncover your eyes now. Thank you. Now I want you to focus on my nose, please. Focus on my nose. An absolutely beautiful and magnificent nose that it is. Focus on it and tell me, please, how many fingers am I holding up? That's correct. That's one finger. Very well done. Okay, let's keep going. 2 fingers, marvelous. So far so good. So far so good. 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 Okay, well done. It does appear you can count up to 10. Very impressive indeed. And now I want you to continue to look at my nose, but I want you to tell me when a finger wiggles. Okay, and I want you to say left, right, or both. Okay, should be straightforward once we get into it. Okay, so here we go. Good. 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 Okay, very good so far. Now I need to check if you experience double vision at all when I bring my finger closer to your face. Okay, so keep your eyes focused on my finger now for this one. I'm going to do this twice, and I want you to tell me, please, if you experience double vision at any point during this, okay? So how many fingers do you see? You see just one finger, and you saw only one finger during the entirety of that, didn't you? Very good. And now I want to mark the edges of your peripheral vision, so to speak. So again, you're still looking at my nose. I'm going to move my fingers in different directions. I need you to tell me when you can no longer see them. Okay, so here we go. what is your favorite insect? Okay, and my next question for you. What is your favorite mythical creature? Very cool choice there. My next question for you. If you could choose one superpower, any superpower at all, what superpower would you choose? Just the one. Very good choice there. Do you believe in aliens? And have you ever seen a UFO before? That's very interesting indeed. And my final question for you, are you into probing? Very good to know. Okay, so thank you very much for answering my questions. Excellently well performed today during the cranial nerve exam, and I am very pleased to say that you do not have brain damage of any kind, and in fact you are in really good health despite the experiments that I've been doing on you so far. So that's very good for me to know as well, because it's obviously better for me to have a healthy specimen to work with and to experiment on than some sickly, grotesque little creature. But so far you are just grotesque. You aren't sickly at all. You're in good health. A very healthy, grotesque creature, I would say. Okay, so we're all finished today. Thank you very much for doing so well and being so compliant and submissive. I really do appreciate that. Okay, I'll see you whenever I see you. Maybe I'll do some horrifying experiment on you. Okay, so look forward to that. Goodbye. Sweet dreams. Hello there. My name is Dr. Jones. Very nice to see you today. Please do make yourself nice and comfortable. I do believe we are booked in for a cranial nerve exam today. Is that correct? Very good, okay. I'm sorry, what is your name? Could you confirm that for me? Very good, nice to meet you. Okay. Before we do anything today, I'm going to pop on my latex gloves, okay? Absolutely essential that I'm wearing gloves throughout all of today's examination for hygiene purposes, of course. Okay, so if you'll excuse me for just a minute. Okay. That's it. I've got them fitted to perfection now, and that's just how I like them. Okay, right. The first thing I'm going to do to you today is a sharp or soft test. Okay. For this, we're going to be utilizing the special cotton bud. Okay, special because one side is soft, as you can probably see. As you can probably see there, that's quite soft, isn't it? And this side is a little bit more pointed. You might say it's sharp. Okay, obviously it's not actually sharp, this sharp or soft? Okay, so here we go. The first time now. Sharp or soft? Very good. Sharp or soft? Very good. Here we go. Sharp or soft? Very good. Here we go. Sharp or soft? Very good. Sharp or soft? Very good. One last one. Sharp or soft? Very good. Okay, excellent job. You can open your eyes now. Very good. Okay, now what I need to do is I need to palpate your face. Okay, that's just a fancy way of saying I need to poke your face a little bit, tap your face with my fingers. Okay, so I'm just going to be tapping your face a little bit, tapping your face a little bit. Okay, and I'm just trying to see how your facial muscles react, basically. And also I'm trying to see if there might be any twitching, anything like that, okay? Any sort of unexpected response. Also, I'd like you to tell me if you experience any pain or discomfort. Okay, so how was that? Did you experience any pain or discomfort? No, all okay. Very good, excellent start to the exam. Very good. And now I'm just going to quickly check your reflexes. Okay, so if you could hold your arm out straight for me, please, just like that. Very good. And I'm just going to 3, 2, 1. Very good, very good. If you could hold out your other arm for me, please. 3, 2, 1. Very good. Okay, now I just want you to drape your knee over, just like that for me, please. Just bend it ever so slightly. Perfect. Okay, I'm just going to give that a little tap. 3, 2, 1. Very good. And if you could do the exact same thing with the opposite knee for me now, please. Very good. 3, 2, 1. Excellent. Very good reflexes. On point. Very good. Right, my next little test for you, still involving your external limbs, your extremities. Okay, I want you to hold out your arms for me, just like this. Okay, just hold your arms out like that for me. Very good. Okay, I'm going to place my hands on top of your hands, your arms. I'm going to push down. I want you to resist and to push upwards against my hands. Okay, so here we go. Okay, very good. Now I'm going to be putting my hands underneath your hands and your arms, and I want you to push down. Okay, and I'm going to be pushing up. Okay, very good. Now I want you to push against my hands. I'm going to be pushing inwards. I want you to push outwards. Okay, so here we go. Very good. And now doing the opposite. You push inwards, I push outwards. Here we go. Very good indeed. Okay, I'm just going to put my hands on your shoulders now, and I want you to shrug as hard as you can. I'm going to be pushing down a little bit, pushing down a little bit. Okay, now I'm going to put my hand on top of your head. Okay, and I want you to tilt your head backwards against my hand. Okay, very as much as you can, much force as you can. Very good. And now I'm going to pop my hand on your forehead. Okay, push forwards for me, please. Push forward as hard as you can. Okay, now hands on either side of your head. Try and tilt to that side for me, please. Okay, very good. Try and tilt to the opposite side for me, please. Very good. Very good indeed. Okay, well done. Now, I do believe I need you to make some silly facial expressions for me. Okay, so if you could grin for me, please. Grin as wide as you can. Bare those teeth. Okay, very good. You can stop now. That's fine. And can you make a sad face for me, please? A sad face for me. Okay, very good. And I want you to frown as much as you can for me, please. As fiercely as you can. Frown. Okay, very good. And I want you to act surprised. Okay, so raise those eyebrows as far as you can. Very good indeed. And now I want you to blow out your cheeks for me, please. Blow out those cheeks. Blow out those cheeks. Marvellous. Okay, you look very good. You look very good indeed. That's a great sign. You've performed excellently. well during all of those tests, and that's just to take a look at your muscle strength performing certain movements. Most of that is what that's about. Okay, so what's next on the old cranial nerve exam? Let's have a look, shall we? Let's have a quick look. What have I got in store for you? I want you to follow my finger, please. Okay, so keep your head still and use just your eyes to follow my finger as it moves about. Okay, looking at the tip of the finger. Just use your eyes to follow my finger as it moves about, and I'm just going to be looking at your eyes as you do this to see the health and the quality of your eyes. Okay, we're going to do this on the other side now, just so I can get a better look at this side. Very good, keeping your eyes focused on my finger as it moves about. Very good job indeed, very good job indeed. Okay, excellent, excellent. Let's see, what's next? Let's have a quick look, shall we? Right, I need to inspect your eyes further, and to do that I'm going to use a light. Okay, I'm just going to bring in this blue light. It is quite bright, so I'm going to hold it a bit further back. Okay, let's repeat the previous experiment where you follow the light for me, please. Follow the light with your eyes. This time, obviously, the light is affecting your irises and their dilation, okay? And I'm just going to be looking at how they're behaving with a combination of light exposure and movement. Okay, absolutely marvellous. Let's move on to the other side again, just for me to get a different perspective on your eyes. More than anything, just to confirm my findings. Okay, keep following that light for me, please. Doing absolutely marvellously. Well done, well done. Okay, very good job. Now I want you to focus your eyes on my nose, please, okay? And what I'm going to do is I'm going to flash up a number of fingers in various different places, and I want you to tell me how many fingers am I holding up. Okay, so here we go, starting now. Very good. 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 Very good indeed. Well done. Now I want to do the finger wiggle test. Okay, so still keeping your eyes focused on my nose, please. I'm going to wiggle my fingers in various different places and in various different ways. Something like that, or like that. And I want you to tell me, please, which finger is wiggling, left, right, or both. Okay, so starting that now. Good. 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 Very good. 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 Okay, very good. I'm just looking at your peripheral vision during these exams, and now I want to try and mark the edges of your peripheral vision, so to speak. Okay, so if you could focus on my nose once again, I'm going to move my fingers in various different directions like this, and I want you to tell me when you can no longer see them. Okay, so we're going to begin doing that test now. Very good. Do a different direction. Very good. Another direction. Marvellous job. Marvellous job. I'm going to take a step away from you now, quite far, and we're going to perform the exact same thing, okay? I'm just going to ask you to focus on my finger, and the finger's going to move a little bit closer to you, okay? A little bit closer, a little bit closer, a little bit closer. And then it's going to move further and further away, and I need you to continue to focus on the finger at all times, please, okay? At all times. Just going to repeat this motion a couple of times, okay? And this is just to allow me to see how your eyes behave in regards to focus, okay? And I want you to pay particular attention as to whether or not you experience double vision during any portion of this. So if you see two fingers as opposed to one, okay? So how was that? Did you see two fingers instead of one at any point? No. Excellent. Okay, that's a good sign. Right. I think it's time for the eye chart. Right, I would like you to remain standing where you are, please. And don't lean forwards, don't lean backwards, okay? We're going to go through this quite quickly. What is this letter? This letter. This letter. This letter. Very good. Very good. Very good. Okay, good. That's good, that's good. Excellent, excellent. So, very good. So marvellous, marvellous. Oh, good job, good job. That's good again. That's good, that's good. Marvellous. Very good, very good. Yes, that's good, that's good. Oh, very good, yes. That's good, good, good. That's very good, yes, yes. That's good. And the last line, is it the last line? Oh, very good. Very good. Very good. Very good. Very good. Marvellous job, okay. And how about these colours at the bottom? Okay, what is this colour? That's green. What is this colour? That's red. Very good. Can you cover one eye for me, please? And I'm going to point at random lines that I want you to read out for me, okay? So here we go. This line here. What is that line? Very good. How about this line? Can you read that line out for me? Very good. How about this line? Very good. How about the final line? Can you read that? Okay, very well then indeed. If you could uncover that eye and cover the opposite eye for me, please. Same test. Can you read this line for me, please? Now this line for me, please. Now this line for me, please. And now this line for me, please. Very good job indeed. Very fast as well. That's good. You can uncover your eye now. Okay, do you want to just perform a split vision test very quickly? And for this, which light do I want to use? Yes, this one here. Very good. And I want to pop my hand along your nose to split your eyes, so to speak. Okay. And then I'm going to put the light on here. As you can probably see, it's only been exposed to the one eye. Okay. And I'm just going to be observing how your eyes are responding. Okay. Obviously the light is only going into one eye. Just going to see how they behave, okay? And now I'm going to be doing it in the opposite eye, okay? Let's have a look. Light's going on, very good. Oh, got a little bit stuck to my glove there, didn't it? Got a little bit stuck to my glove there. Okay, you don't need to be particularly focusing on anything. Okay, just taking a quick look. Taking a quick look indeed. Very good. Marvellous job. And if you could just very quickly follow the light with your eyes for me, please. Keep your head still. Just move your eyes. Once again, just having a quick look at your eyes, okay? Observing their overall health. Very good. We're doing it over here now. Continue, continue, continue. Continue to follow the light with your eyes. Very good indeed. Very good indeed. Okay, just switching it out. Keep looking at the light. Keep looking at the light. On the other side, keep looking at the light. Keep looking at the light. examining of your eyes section of the cranial nerve exam now. So I've got this lovely, clean, fresh, brand new nib on the otoscope, of course. Only the best for you. I'm just going to be quickly looking in your eyes. Okay, so let's have a quick look in these eyes of yours. Ears. Sorry, I forgot what these were called. That's not very good for a doctor, is it? Not very good for a doctor at all. Okay, a little bit of earwax build-up, but nothing too excessive. Nothing that I wouldn't expect to see in the average person, okay? And once again, just going to be looking in your ear over here this time. Looking in your ear over here, your ear over here. Very good. Very good. Very much the same as the previous ear. Little bit of earwax build-up, nothing to be too concerned about. There's no redness, no sign of soreness or infection, which is very good indeed. Have you experienced anything negative with your ears recently? Pain, discomfort, loss of hearing? No, everything's been good. Okay, I do just want to quickly whisper a couple of words or numbers in your ears, and I want you to repeat back to me, please, what I whisper. Okay, so we're going to do that now. Coconut. Coconut. Very good, very good. Okay. Technical. Technical. Very good. Okay. Asparagus. Asparagus. Very good indeed. Okay. Spaghetti. Spaghetti. Very good indeed. Okay, we're going to do a couple of numbers. 792. 792. Very good. Very good. Okay, here we go. 83. 83. Very good. Okay, I'm happy with that. We're going to be doing one last very rudimentary hearing test now, and that is basically I'm going to be creating a noise with my gloves. I'm going to move my hands further and further away from the sides of your head, and I want you to tell me when you can no longer hear the sounds, okay? So we're going to start that now with both ears. Okay, very good. We're going to do just the one ear. Very good. The other ear now, of course. Okay, very good. We're going to repeat the experiment just for a little bit of very good. This ear. Good, this ear. Absolutely. Well done. Perfect. Okay. So I'm satisfied with your hearing. I think it's very good indeed from what I can see. Anyway, next test we are going to do a taste test. This is quite exciting. I like this part of the exam. Okay, I've got 3 artificial flavors for you. I'm just going to quickly grab them for you. Okay, and we have here artificial flavor number 1. I'm just going to shake it up very quickly and then pop a little bit on your tongue. Okay, I'm just going to be putting a little bit on your tongue. Right. Okay, so if you could stick your tongue out for me, please. Very good. Just going to drop a little bit on there. And what does that taste like? Coconut. Very good indeed. Okay. Artificial flavor number 2. Let's go. Sorry, I do need to shake them up just a little bit because they do sit on the shelf for quite a while. There is no expiration. It is an artificial solution, but you know, I do want to shake it up just to make sure that the flavour is consistent throughout. Okay. this artificial flavour number 2 tasted like? Papaya. Very good indeed. Very good indeed. I love papaya. I love papaya. Excellent fruit. Right, we're on to the third and final artificial flavour for you to identify, okay? Third and final. Right, are you ready? Okay, just a little droplet on your tongue there, little droplet. Very good. And what does that taste like? Coffee. Coffee, yes, coffee. Very good, correctly identified all 3 flavours. Now that is a good sign indeed. Now, we have a very similar series of tests for you. The smell test, okay? And I have 3 artificial scents for you to smell. Once again, I just got to shake up the bottle for you, a little bit different consistency. These smells more gel-like as opposed to liquid, I suppose. Higher viscosity. Okay, so I'm just going to open this. And if you could prepare those nostrils, okay, take a good sniff of that for me, please. A sniff. And what does that smell like? You want to smell it again? Okay. A little bit of trouble, maybe a blocked nose. Have a sniff. What was that one? Mint. Very good indeed, okay. Moving on to scent number 2. I'm just going to monitor how well you do with the remaining 2 smells. Okay, it is possible perhaps you just have a little bit of a blocked nose, okay? Not necessarily a big deal, doesn't necessarily indicate any problem, okay? So, let's have a smell of this one, shall we? What does this one smell like? Lavender. Okay, very good. You managed to identify that one quite quickly. That's promising. That's very good. Okay, third and final smell. Let's just give it a little bit of a shake up, shall we? A little bit of a shake up. Prepare the smell for you. Okay, here we go. The final smell. Have a little bit of a sniff of that. A sniff. What does that one smell like? What does that smell like? Lemon. Very good. Okay, so you did correctly identify all the smells in the end. It just took a little bit of time for you on the first one. I don't think that's a big deal. I don't think that's an issue at all. Okay. Well, I have to say, I believe that's the end of our cranial nerve exam today, and I think you've performed very well indeed on all aspects of the examination. Eyesight, very good. Hearing, very good. Sense of smell and taste, very good. And of course, your ability to physically move, the strength of your muscles, your sense of feel, for lack of a better word, your feeling, all seems to be working in tip-top condition. Okay, so I'm satisfied that you're in good health, and I don't think there's any need for further testing or anything after this, okay? So I'll just be sending your results and my write-up, my report of today's exam to your general practitioner, and they'll probably have a chat with you, just a routine chat, just to confirm that everything is okay with you, okay? So you can expect to be contacted by your doctor in perhaps 1 week, something like that. Don't worry if he takes 2 weeks though, you know. Maybe he's lazy, might be a bit lazy, might be busy, okay? Thank you so much for coming in today and for performing so well during the exam, and also thank you just for being so pleasant